Dr. Harrelson, it is ironic, and it's going to, because you pointed something out that's very important. Physicians are legitimately unhappy with the way CMS establishes reimbursement rates. We call it the sustainable growth rate. It's unrealistic. So what they're proposing is what you basically were saying, and that is pay for performance. The amazing thing, and we want you to use your independent judgment and choose that treatment and protocol, and of course we're talking about medical devices too, that will get you that result that we're seeking, right? However, what we have in place today and what we're hearing, we're going to restrict your ability to pick that device or even maybe the treatment that you in your professional opinion believes will result in the quickest recovery and such. Pay for performance. I know it's odd, and you go back, and I'm sure you have great discussions about who we are over here in Washington, and rightfully so. Now, you heard the witness, Mr. Wilson from CMS, and it appears his answers are really good, and he knows a lot more about the subject than all of us in here, because that is his full-time job. But when your specific issue about exempting physicians for what you do, and it seems very reasonable, what was their response? Because surely they heard your objection and your request, and surely they responded. What was that?
Well, we did have some discussions with them, and frankly, at first they seemed to agree with us, and we thought actually they were going to exempt physicians from the competitive bidding, and especially from the competitive bidding for the things that we supply were really just braces and splints. We don't do the other DME, the wheelchairs. We do like to have crutches so the patients can ambulate out of the office. But we assumed that they were going to exempt us, and we're frankly a little dismayed that we were not included, because they did exempt physical therapists and occupational therapists. And it's a little bit odd that in many cases orthopedic surgeons employ physical therapists, and so we have a situation where my employee can provide the DME, but I cannot.
And now, Mr. Staub, you heard Mr. Wilson, who indicated, sure, when we call it the VAC wound therapy, yours is not the only device out there. Now, people are going to say you're not that objective, Charlie. KCI is in San Antonio, and there's an element of truth to that, but I also have been a beneficiary of a lot of information, and I know the studies that have taken place. I know the physicians and the clinicians. I know what they're saying out there about the superiority of a particular product or device, not necessarily just yours. Well, how do you respond? They've done their homework, they've done their research, and FDA approval. It looks like you have all these other devices, and it doesn't matter if yours may be the device of choice by the physicians, the attending physicians.
You know, Representative Gonzalez, it's very disappointing, actually. That's our response. And the reason being is 2 points. Number one is that the way these products are approved, as he had said, there's a PMA or a 510K. A 510K is a more basic approval, which basically proves that the product is safe and says that it acts the way you want it to act. Basically, it does what you say it will do. But clinical studies, really, usage on a patient doesn't happen unless you have a PMA. So they come on to the market as predicate devices saying this is just like that one. But they are actually very, very different. Not only the way the products are made up and the way they act with the patient, but I think the second point that's most important is around this accrediting. I mean, the accrediting that we saw was really just around financial capabilities of these companies, not around their ability to service or care for the patients by any means. And these guys have mentioned, I think, a couple of times, we have over 450 clinical nurses that are out in the field. We have over 1,200 service people that are out there that answer these calls late at night. And I don't think these companies that come in and, I use the term carpetbagger loosely, but basically want to get the bid to either sell the bid to someone else or to try to then find a supply and support that market. I think that's extremely disappointing for us, because we feel like we seriously help patients that are compromised and at home and have no one else to help them, and it's a less expensive alternative, quite frankly, than having their surgeons keep them in the hospital for another 2 weeks or 3 weeks until their wound heals. So my response would be that it's disappointing that they haven't gone deep enough in understanding and accrediting potential suppliers.
Yeah. And to Mr. Height, Mr. Sutton, Mr. Einfalt, this committee is obviously the Small Business Committee, and we're very sensitive to what's going on out there. And our chief concern is really the impact of all this on small businesses. Dr. Einfalt, we're familiar with the average manufacturer's price, what it's going to do to you, because we've had other hearings where we've had our community independent pharmacists. Mr. Height, Mr. Sutton, we've had other hearings by different subcommittee, and we're very familiar with some of the issues and the challenges that in providing a service. I know we had a home care provider from Texas that was saying just with the cost of gasoline, now we're talking about certain areas of Texas, you drive forever, and that's not part of the calculation at arriving at what it takes for you to provide a service or a device. Now, that's not realistic. That's not reality-based. So it's so important when you come and testify here. My fear is that Mr. Height and Mr. Sutton are probably going to be relegated at best to some sort of a subcontractor status. And that means a whole lot, I think, to small businesses today when you're the owner of a business as such and what will be dictated to you. So again, I just want to say thank you for your testimony, and I yield back, Mr. Chairman.